Good day. We are the group number Z3170. I, Angel Bernadette ABALLE, with my co-researchers, we're going to present the research study entitled Utilization of Mental Health Application and its Relation to Mental Health Behavior. Introduction. Mental health behavior refers to an individual's ability to handle regular life stressors, work in a productive manner, and contribute to their society. Globally, the advent of smartphones and application presented a huge opportunity to improve mental health care. That's according to the study of Zelasek et al. 2022. In the Philippines, a great demand for app research and health behavior modification is unmet. Even though the country recently approved its first Mental Health Act and Universal Healthcare Law, mental health receives barely 5% of healthcare funding. Locally, there is a Mindanao project where it describes a model of mental health care and the characteristics and outcomes of patients attending mental health intervention. It shows in their study that simple mental health approaches such as psychological first aid and brief psychotherapy can be integrated into primary healthcare in an emergency context. However, the researchers have not encountered any study about the utilization of mental health applications and mental health behavior at Tagum City. This only means that the current study must contribute significantly and produce novel information and data on utilization of mental health application and mental health behavior of users of mental health-related apps at Tagum City. With that, the researchers were urged to seek factors that can lead to the mental health behavior of mental health app users.
I am SARIN and I'm going to present the related review literature. The independent variable of utilization of mental health application has 4 indicators. This is likability, features, mechanism, and interface. The first indicator is likability of the apps are known to influence engagement with the app. Users' likability in the general functionalities of the mental health-related application increase their usability, which they enjoy and are satisfied with, creating a huge impact to their mental behavioral condition. Utilizing digital health solutions, it is possible to improve the usability and accessibility of healthcare. The second indicator is features of the applications are also known to influence utilization of the app. The user interface or UI, attractiveness, and compatibility are the most salient app attributes of stimulating engagement according to Fang et al. 2017, and similarly, study of Persky et al. 2018 states that the features are ranked as most important for engagement. The third one is mechanism that are integrated in an intervention have been shown in non-technology environments to impact behavior, Hodge et al. 2017, and moreover, mobile applications have shown potential in assisting persons with mental health disorders to adopt healthier lifestyles through various behavior change strategies, Altani et al. 2019. And the last indicator for our independent variable is interface. As discussed by Glowag 2022, application interface, or also known as user interface, where an application provides a set of features with a purpose to a user-friendly that may supply input to and receive output from the program. Next is dependent variable, which is mental health behavior, which has 5 indicators: perceptions, beliefs, attitudes, confidence, and self-efficacy. First is perception. A qualitative analysis of user reviews revealed that user can see correlations between physical activities and mental issues, see the gaps in perception, and identify the triggers, a reason that cause mental disorder, or what activities are inappropriate, and hence they can adjust or make changes in either thinking or habits to achieve better emotional states. Second is beliefs. It appears in the study of Alcantani and Orji 2020 that using the application, some reviews mentioned slightly on the ability to share feelings in a specific topic, the understandability of content and community, ability of community to make them improve into a more positive person. Third is attitudes. By McLeod 2018, attitudes are known to measure behavior. An attitude is a generally persistent arrangement of ideas, sentiments, and behavioral inclination towards socially relevant objects, people, events, or symbols. Fourth is confidence. Self-confidence refers to the confidence that we have in specific areas of life and about trusting yourself and your abilities to achieve goals and succeed at challenges. And lastly, the self-efficacy. This is as a motivational orientation that stimulates grit when faced with difficulties, enhances deliberate actions, encourages long-term view, fosters self-regulation, and allows for self-correcting whenever necessary. Gusuglo 2015.
JUDEL LANTAYONA, I am going to present the research objectives of our study. The study's main objective was to determine the significance of utilization of mental health applications and mental health behavior of mental health-related apps users in Tagum City. Specifically, the study is conducted to answer the following queries: utilization of mental health applications and mental health behavior of mental health apps users at Tagum City. Number 1. To ascertain the level of utilization of mental health applications in terms of likability, features, mechanisms, and interface. Number 2. To ascertain the level of mental health behavior in terms of perception, beliefs, attitudes, confidence, and self-efficacy. Number 3. To determine the significance relationship between utilization of mental health applications and mental health behavior. Using the findings from the prior study, the research developed the following null hypotheses, which are evaluated at 0.05 level of significance. The null hypothesis states that there is no significant association between utilization of mental health apps and mental health behavior. Methodology. The participants of this study comprise 250 individuals that were identified to use a mobile mental health app in the previous 6 months to be eligible for the study. The inclusion criteria participants must be bona fide residents in Tagum City, be at least 18 years old above, and have used mobile mental health apps in the previous 6 months. Participants indicated that demo and identify if the app is considered as a mental health application. Other exclusion criteria were apps developed for a specific group of people with health-related conditions, patients with congenital heart disease, or diabetes. The selection of participants was done through purposive sampling. Materials and instruments. The survey used in the study was a research-made survey questionnaire as a means of an instrument for data collection. The first part of the questionnaire deals with the utilization of the mental health app scale, which requires the respondents to evaluate their experience in using such apps and whether or not they are satisfied. The second part of the questionnaire deals with which require the respondents to overview and assess their mental health behavior in distant mental health apps, whether they are satisfied. Design and procedure. The researchers employed a descriptive correlation research design applying quantitative processes. After receiving approval from the panel members, the researchers follows the stages and procedures outlined below to collect data for the study. The researchers next seek authorization from the City Mayor of Tagum. Appendix A. Following the approval, the questionnaires were distributed directly to the participants who met the inclusion criteria via Facebook and Messenger, which participants could view via their computer browsers. The researcher administered the questionnaire individually and outlined the study tool's purpose. Additionally, the researcher gathered survey questionnaires from respondents who had completed all questions. And finally, the researchers compiled and tallied all the data collected from respondents before doing a statistical analysis. The following statistical techniques are used to tabulate, evaluate, and analyze the data collected by the study instruments. First, mean. Next, person R. And lastly, regression analysis.
Results and discussion. Utilization of mental health applications. The overall level of utilization of mental health related application is disclosed in Table 1. Data include the obtained means of the 4 indicators with very high and very low descriptions. These indicators with mean ratings are as follows. Clickability got a mean of 3.86 described as high. Features obtained a mean of 3.81 described as high. Mechanism obtained a mean of 3.82 described as high. Interface obtained a mean of 4.29 described as very high. These indicators obtained an overall mean of 3.95 described as high. The result implies that, generally, the users of mental health related applications have acquired a useful tool for managing their mental health behavior. Users have use mental self-help apps to self-monitor to enable them to track their moods and emotions. The result implies that generally, the users of mental health-related applications have acquired a useful tool for managing their mental health behavior. Users may have used mental self-help apps to self-monitor to enable them to track their moods and emotions over time. This result is in conformity with a study conducted by Schweller et al. 2018, indicate that user engagement is key to the effectiveness of digital mental health interventions, and Wang and Bachelor 2017 stated that mental health apps can be a powerful instrument for mental health care and intervention. Mental health behavior. The overall level of mental health behavior is disclosed in Table 2. Data include the obtained means of the 4 indicators with very high and very low descriptions. These indicators with mean ratings are as follows. Perception got a mean of 3.87 described as high. Beliefs obtain a mean of 3.82 described as high. Attitudes obtain a mean of 3.67 described as high. Confidence obtain a mean of 3.42 described as moderate. And self-efficacy obtain a mean of 3.76 described as high. These indicators obtain an overall mean of 3.72 described as high. The highly observed mental health behavior among users of mental health apps in Tagum City was perception. Users' perception of mental health application indicates that they highly appreciate the ability to monitor and reflect themselves and to figure out what is going on in their mood of the apps. This was followed by beliefs, being the second indicator. Perceived beliefs are of particular importance as it is a strong and robust predictor of help-seeking behavior and a factor that can theoretically be modified based on health promotion programs. This is followed by self-efficacy with the third highest mean. In a study of Schoenfeld et al. 2015, self-efficacy is a mediator of the effects of daily stressors in mental health, with superior effect size for positive compared to negative mental health. Findings suggest that self-efficacy operates as a buffer of daily stress. Low self-efficacy in turn is related to more symptoms of anxiety, distress, and depression. Regarding attitudes, in predicting specific actions requires a measure of attitude toward the behavior itself, as in the reason-action approach, which takes specific behavior as its starting point and identifies intentions, attitudes, norms, and perceived behavioral control as important determinants. That's according to the study of Zen et al. 2018. In terms of confidence, is the last indicator with the lowest mean. Evidence illustrates that self-esteem can lead to better health and social behavior, and that poor self-esteem is associated with a broad range of mental disorders and social problems, both internalizing problems and externalizing problems. Overall, the mean scores for the indicators of mental health behavior of users of mental health application with an overall mean of 3.72 described as high with a standard deviation of 0.45. The high level could be attributed to the high rating given by the respondents in all indicators. This means that the level of mental health behavior among users of mental health related apps at Tagum City was observed most of the time in the terms of perception, beliefs, self-efficacy, attitudes, and confidence. Relationship between utilization of mental health application and mental health behavior. Table 3 examines the relationship between, as measured, utilization of mental health application and mental health behavior. The association is determined using person R correlation analysis. Overall, when the R value 0.872 was tested for significance, the computed R squared was 0.7604, which is significantly more than the tabulated p-value of 0.05. Consequently, the null hypothesis is rejected. The p-value is 0.001, which is less than 0.05 level of significance, thus prompting the rejection of formulated hypothesis, which stated that there is no significant relationship between utilization of mental health-related apps to the mental health behavior of users is rejected. Thus, it implies a significant relationship between the utilization of mental health application and the mental health behavior of users.
In conclusion, this study shows a significant relationship between utilization of mental health application and mental health behavior among user of applications in Tagum City. This implies that as the user increases utilization of mental health application, their mental health behavior level likewise increases. Similarly, when utilization of mental health application decreases, a decline in mental health behavior level becomes apparent. This implies that utilizing mental health applications may result in an improvement of their mental health behavior and vice versa. This solid interrelationship between utilization of mental health application and mental health behavior is critical to reducing the mental health issues experienced by users. Moreover, the result also suggests that the problem of utilizing mental health apps may be resolved by a variety of solutions, as addressing one variable can affect the other. For our recommendations, in light of the following facts and conclusions, the following recommendations are proposed. Developers should employ the participatory design method during the design process and ensure that they involve users in the design process. They should also consider getting input from clinicians during the design and evaluation stage, which also increase the trust of the app. Finally, researchers may also consider conducting further investigations related to the variables identified in this research. The challenge now is to investigate the other indicators belonging in the variables which were not identified in this study. Similarly, as the sample size in this study is small, future studies may consider conducting the same topic on a wider scale and with a great number of respondents.